Greetings, Dr. Mark Winton here from University of Central Florida Department of Criminal Justice. In this video, I'd like to address pedophilia. One interesting feature before I get into defining pedophilia is that there appears to have been a decline in reported rates of child sexual abuse since the early 1990s. So this is actually very good news. That maybe all the work that we've been doing to try to prevent child sexual abuse has been working. But sex offenders against children are still considered a major societal problem. The term pedophilia, child molester, and sex offender against children are often used interchangeably, but there are differences. For example, a sex offender against children may not be a pedophile. And there may be someone who is diagnosed with pedophilic disorder but hasn't engaged in sexually abusive behavior. So that's important to recognize. Sex offenders against children and pedophiles are from very diverse groups regarding their demographics, their sexual behaviors, the strengths of their sexual interests in children, and the selection and number of victims, as well as the level of violence. Pedophilia was renamed Pedophilic Disorder in the DSM-5, although it retains the same diagnostic criteria from the 2000 edition. Now, looking at the definitions of pedophilia, that is provided in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, published by the American Psychiatric Association in 2013, from page 697, includes the following criteria. Over a period of at least 6 months, recurrent, intense, sexually arousing fantasies, sexual urges, or behaviors involving sexual activity with a prepubescent child or children, generally age 13 years or younger. The individual has acted on these sexual urges, or the sexual urges or fantasies cause marked distress or interpersonal difficulty. The individual is at least 16 years and at least 5 years older than the child or children in criterion A. Further specification focuses on whether the pedophile is attracted exclusively to children, to boys, girls, or both, and whether the abuse is incestuous. Also, Bricken, Fedoroff, and Bradford, 2014, in their article, point out that there is no in remission specifier, as there is in other mental disorders, which may imply that it's a lifelong disorder, although research doesn't seem to support that one way or another. One of the problems, of course, or I should say multiple problems exist in that definition. And, if we go back, we think about, over a period of at least 6 months. Well, why 6 months? What happens 4 months? Okay. Recurrent, intense, sexually arousing fantasies, sexual urges, or behaviors involving sexual activity with a prepubescent child or children. Okay, so how do you actually define, or how do you know, what's considered recurrent, intense, sexually arousing fantasies? So, and the individual's acted on these sexual urges. Well, that's behavioral acting, or the sexual urges or fantasies cause marked distress or interpersonal difficulty. Again, what does that mean, marked distress or interpersonal difficulty? So there is definitely some ambiguity in the definition, and a lot of times we're using clinical judgment that's very relevant to each particular case. So that is important to take a look at. It is estimated that 40 to 50% of sex offenders against children are pedophiles, and that's from the research of Dr. Cito, 2008. And the American Psychiatric Association, 2013, in their DSM-5, estimate the upper limit of males with pedophilic disorder to be around 3 to 5% of the population. and female rate is lower, although there may be gender bias. So 3 to 5%, that's really a lot. That's really a lot. Many pedophiles report sexual interest in younger children starting when they were adolescents. So we get into the whole idea that we may be looking at a developmental process here, and so this would of course mean that early identification and treatment is extremely important. Also, though, labeling a child or an adolescent as a sex offender can have various negative consequences. You know, the big question is, can we prevent juvenile sex offenders from becoming pedophiles? And that is really very important for policymakers to consider what to do. In terms of risk factors for pedophiles and other sex offenders against children, some of these seem quite obvious, but and some of them are not specific to pedophiles or other types of sex offenders. They occur with other, non-sexually abusive people, obviously. But having a sexual interest in children is more specific. But also, as I mentioned in other videos, also having other mental disorders and even perhaps substance abuse disorders. There seems to be an increased risk with a childhood history of sexual abuse or other child abuse or neglect, an increased risk for pedophilia with those with brain abnormalities, also increased risk with negative prenatal events, stress, antisocial behavior, poor social skills, and previous criminal behavior. And that's from Cito 2008 in his book, and also Winton and Mara 2013 in our book. We also want to take a look at if sexual abuse is occurring with co-offenders and other factors related to the number of victims, the extent of the abuse, of course, the type of threats that are used to keep disclosure from occurring. So there's a lot really in investigations that we have to contend with, and of course, probably as far as a skill that you would want to have working in the field would be, for example, if you're interviewing, perpetrators, you want to be able to have, those skills of interviewing perpetrators in general, but also having, some specific skills focusing on their sexual deviations and illegal behaviors. Also, if you're interviewing victims, you want to have background and experience on how to interview children and adolescents, and also have some background in developmental psychology and understand the interviewing process, what types of questions are appropriate at what particular age, and what types of tools can be used, for example, drawings and artwork, puppets, things of that nature, support animals, depending on the age of the child. And so there's a whole area there that's important to become proficient in if you're going to do those types of cases. So I think I'll wrap up this video here, and in the next video I'm just going to address some of the myths regarding child sexual abuse. Thank you.